It's Sunday, March 29th, 2020. I'm your host, Lisa Evers, and I'm so glad you're joining me for this special 2-hour live broadcast as we continue to fight to survive the coronavirus crisis in terms of the deaths that we're seeing and these numbers. What are people actually dying from the coronavirus, or they're dying from because they can't breathe from it, or because there's other things going on?
Correct. So when you have the coronavirus, the most severe case, you end up with pneumonia, right? And so basically what happens is your lungs get congested, right? You have inflammation, feel like you have a very bad cold. If you ever had pneumonia before, typical kind of pneumonia that you have, and so there's no air passage going through it. And so people that are most susceptible to this are people that have comorbid conditions, right? And so we talked about the elderly. So age is one factor. Then we talk about things like asthma, right? Which we have a lot of people with asthma. Kids have asthma.
Especially in the city, yeah.
Correct. Asthma, especially with air pollution and everything else, right? When we talked about this, in the city, you find a lot of those. And then majority of patients actually in New York City that actually died from this disease had diabetes and heart conditions. Right, so that puts them at higher risk. So think about it. If you have any kind of emphysema, COPD, which is any kind of lung disease, and you have heart failure where your heart is actually weak and you can't pump enough blood, right? And now you're congested. So you're at higher risk of actually recovering from the disease than if you're actually a healthier person.
Now we're here, 1-800-223-9797. This is Street Soldiers. I'm your host, Lisa Evers. With us in studio, Dr. Emmanuel Fombu. And we're taking your telephone calls. Let's go to Russell right now. Russell, hi, you're on Hot 97. Go right ahead. All right, we just lost him. Call back 1-800-223-9797. Our phone lines are open. Dr. Manny, in terms of the frontline workers, because I've gotten so many text messages on my Instagram, all of these things about, gas station attendants in the state of New Jersey. They have to pump the gas for you. It's not like New York where you can do it yourself. They're concerned because they're there. They're getting the card from the person. They're going to the person's window. A lot of them feel they should be wearing masks. They should be wearing gloves. It can't hurt, right?
No, correct. It definitely cannot hurt, and I think it's a good way to look at this. Just your frontline workers does not only mean healthcare workers, right? If you're an Uber driver, you're a frontline worker. If you're delivering food, you're a frontline worker, right? So if you're at a gas station, you're a you're a frontline worker. And last night I got a very interesting one. I was just online cruising some Facebook websites, and I found out that you have correctional officers being some of the people that are being forgotten in this battle, right? They still have to go up to jail, and they have to work in prisons and others, right? And you have people being arrested, and you heard about breakouts in certain jails.
Dr. Manny, we've got a lot of people that want to get in on this. Let's go to Sandra right now. Sandra, hi, you're on Hot 97. Go right ahead.
Hi. My brother was tested positive. He works for the post office. He was tested positive for the virus. And he called emergency to try to come in because he has diabetes. When he has the chills, the body ache, the cough, and because he doesn't have an appetite, his sugar is high. He called emergency to try to go in, and they told him he just has to sit this out at home. How do you get help? And I believe that a lot of people may be dying because it's hard to get help. How do you get help for this virus?
All right. Dr. Manny, Sandra's talking about her brother had diabetes. He went to the hospital. And then, Sandra, they just told him to go home? He tested positive?
Well, so he tested positive. They sent him home. So he called back because he wanted to come in, and they told him he has to sit in isolation at home. He doesn't fit the requirement.
And what state is this? Is this New York State?
This is New York State.
So did he have
symptoms?
This is
Kings County Hospital.
Did he have symptoms?
Yeah, fever?
He has the symptoms. I even called myself and spoke to someone in the emergency room. They gave me a number to call 311. I called 311, and they had information if he needed to be tested. I said, well, he was tested already. What do you do? Because the emergency room gave me 311. They told me to call 911. You can't walk into the emergency room with him.
Wait, this is important. So he goes to in Kings County was where my mother was a registered nurse. So I'm really and a lot of people, it's a very important hospital, especially for Brooklyn residents. In terms of your brother he has diabetes, correct?
Yes.
High
Okay.
risk.
So he's already in the high risk category. He goes to the hospital to get tested.
Correct. He did the walk-up at Kings County. He got tested Friday.
Okay.
They called him today with the results and told him he was positive. And he's, sickly. So he called back, I believe it was Tuesday, to try to go in, and they told him to call 311. But he had this terrible cough, the trouble breathing, the high sugar because there's no appetite. But, why are they telling him to sit at home in isolation? And they gave me, the 311 number to call.
Okay, the only
I don't
thing,
understand how you
Sandra,
get
I don't understand. I don't understand that. The only thing I can think of is that I know from, and we're going to hear from an emergency room doctor a little bit later in the show, is that the city hospitals, especially the city public hospitals, have been have been packed. So they just may not have had a bed for him because there were other people that needed to go right away on a ventilator or something like that.
Correct. And even in that situation, so you mentioned a key item as a new symptom since we last discussed last week, right? We talked about fever, we talked about shortness of breath and everything else. But we know now that the loss of smell and the loss of taste is a symptom, right? That some people experience when they have this infection. So that's pretty standard. And your diabetic patient, and if they have fever and symptoms, I think that should be a high priority and high on the triage list.
Right.
And we do know that the city is overwhelmed, like you don't have enough beds. I think on Monday, it's a naval ship actually coming down to Pier 90.
Right, and
so-
this is what, and Governor Cuomo has been on this from the beginning.
Correct.
Saying, listen, we're going to need more beds because as this, I guess, I don't know what the medical terminology is, but as this crests, right?
Correct.
You have the, you're going to, a lot of people are going to be very, very sick and they can't take care of themselves at home. They need to be able to breathe. They need the machines.
Correct, and that's the biggest issue right now, right? When we talk about needs, right? And Governor Cuomo, for example, one of the biggest arguments he was making was that not every state is affected the exact same way, right?
Right.
New York City is already crowded, right? And we have the most number of cases in the country. Healthcare workers are burning out, right? We don't have enough beds.
Left and right.
Correct, and so that's why the Javits Center, for example, is being converted into a hospital.
Into four mini hospitals within the big hospital, 1,000 beds. The ship is coming in.
Correct, but for the caller, I would advise that your brother should probably go back in to a hospital, like physically go in, right? Don't call, just walk into the hospital.
With the symptoms and just tell him he's having trouble breathing.
Correct. That's where the hospital is, and that's where the bed is, right? I mean, if I had a family member that had,
I would drive him. I would walk him there,
go.
take him there, and just not leave until you get him in.
Correct.
All right,
Yes.
Sandra. That's what Dr. Manny's saying. Thank you very much for the call, and I hope your brother gets the treatment and the care he needs. If you want to continue this conversation, you can shoot us a quick email, streetsoldiers@hot97.com, or hit me up on the DM on Instagram @Lisa Evers Blue Check Official. Let's go to Trini right now. Trini, hi, you're on Hot 97. Go right ahead.
Yes, I just want to ask a question about first responders. I love them. My wife had a vacation and everything else. She took away the vacation and she went back to work. But the thing I asking, what I asking is just like, how do we, or what do we need to do to make sure like the kids or the family doesn't get in, as she's working with people and everything every day, she's doing her best. She takes up her clothes and makes sure everything and just goes, and do everything else. But I'm just wondering what as the family of a first responder is supposed to do as to protect ourselves as for,
Basically, how does she not? And I'm glad, Trini. Thank you very much, and thank you for your wife's service, and also for the sacrifices that your family's making at this time. But this is an important question, and let's get Dr. Manny to weigh in on this. These first responders, they're out there. How do they protect their families when they're coming home? How do they make sure they don't bring anything with them home?
That was a great question and something that we don't talk about, right?
Well, we're talking about it.
Not correct, which people don't talk about in general, and which is true. I was at a hospital, for example, last week and this week. And there are a lot of patients that are probably exposed. But if you look at healthcare workers in general, the way you are trained to do your work is to expect that you might get contaminated or something like this happens. So it becomes day to day for you. So people tend to be able to protect themselves with PPEs, right? Which is personal protective equipment. which we have shortage of, that's a different story.
Well, we're
right?
going to get to that too, I'm sure.
But correct. But definitely, I think that family members are at increased risk. Of course, they are at increased risk.
So basically, when they come home, it's like you talked before about like this decon, like they come in the front door and then they just everything comes off there and you're right in the shower.
Correct. So when I go to the hospital and I get home, the very first thing I do is take off my clothes and throw them in the washing machine, right? And take a shower immediately. And so that way you're washing off everything from you. If you had any touch on your clothing, because we know that this lasts on clothing. We talked about this last week, right? On cardboards and in the air, and based on what kind of fat, what is metal, tables, right? So we know.
And we don't know how long it lasts on those surfaces.
Correct. And it lasts for different time periods based on the surface that you touch, right? Some for 2 to 3 days, cardboard for like 24 hours. So in the air for about 3 hours. So we have different estimates of how long it lasts. So the first thing I would advise is, like to the caller, is if your wife comes home or your partner comes home, they're exposed, whether they're gas station workers or wherever you work, or retail, grocery stores. When they get home, the first thing is just get your clothes washed and then take a shower.
Hansel, hi, you're on Hot 97. Go right ahead.
Yeah, hi. Me and my fiance are essential workers, and we're a little nervous because of everything going on, and I'm basically always in cars and stuff like that, and she's a healthcare worker, so we're always around stuff, and they're running out of supplies in the hospital and stuff like that, and I'm just really nervous about the whole situation.
All right, Hansel, in terms of your personal safety, or just in terms of like mentally in general?
Well, personal.
In terms of like how you can protect yourself and your partner?
Yes.
Yes, I think the shortage of equipment has been one of the biggest challenges that we are facing, right? It's completely unacceptable, right?
It is completely unacceptable.
Completely unacceptable, right? Even in China, if you look at the essential workers in China, they're covered head to toe with like perfect,
protective
clothing.
equipment.
Yeah, exactly. And we don't have that here. I mean, that's completely unacceptable. And so I think that's one of the things where, like today, I had some friends reaching out to me. They're collecting PPEs to donate. They're volunteers and they're collecting this equipment for free. To donate to healthcare workers, right? I think it's very important. I think your healthcare comes first, right, and that of your family. So I don't think you should definitely put yourself at risk. If you make sure you have face mask and you have gloves on, if you're coming in contact with people, but at the least you should have a face mask. And then if there's nothing else around, please just make sure you wash your hands constantly and make sure you don't put your hands on your face. Right?
And then what about, I think what Hansel was getting at also too, he's there with his wife or with his partner. They're both out there. She's working as a nurse. He's in transportation. He's a driver or whatever, transportation. He's around people all day, all shift long. They come home. Then do they have to, like, one of them has to sit on the couch, the other one has to sit like 6 feet away, or can they just, since they already have been living together, do they assume that if one of them has it, the other one automatically has it? Because that's another question.
Correct.
We're getting.
So I think the great thing here is,
like, can you kiss them goodbye in the morning, or
Yeah, before you leave, if you get up from bed in the morning, and I'm sure you could kiss them goodbye, right? But once you get back from work, I think one of the first things you should do, like I mentioned, you want to take off your clothes and make sure you wash them.
And if you don't have a washing machine, because a lot of our New York City apartments don't, what I do is it goes into the plastic garbage bag before it goes to the laundromat.
Correct. So that's the basic concept being that you should make sure that you don't keep the same clothes on once you get home, right? So once you get home,
exactly, and go sit on the couch and
Correct.
go sit at the table or whatever.
Correct. We just decrease the risk, right? That's the best we can do. So once you get home, like when I get home today, that's the first thing I'll do. Like take off my clothes and
Exactly.
and put them away, and then make sure you wash your hands and keep yourself clean.
Everything. And shoes come off at the door.
Correct.
The shoes definitely come over the door. All right, 1-800-223-9797. Let's go to John right now. John, hi, you're on Hot 97. Go right ahead.
Hey, how you doing? So I work for New York City Housing Authority, and
Okay, night your worker. All right, thank you.
right, and we were recently told that we have no choice. We have to go into these apartments, even if the resident has coronavirus. They're telling us we have to tell the resident to go in another room and complete the work. Now, to me, I feel like I'm still at risk. Everything's airborne for 3 hours. It stays on surfaces for up to 2-3 days, I've heard. And we're getting minimum PPE. They actually just gave us an email the other day stating that they're not going to be giving out any more masks for any reason whatsoever. How would you go about it?
Okay, well, first of all, first of all, the mask. We always talk about this, but I've pretty much seen everybody in New York walking around with masks on, and the masks are not going to stop the coronavirus, correct? But it's a good idea. We don't know, right?
So initially,
At this point.
if you remember when things first started, we started getting educated in January, February, right? There was this whole campaign about
Don't wear a mask.
Don't wear a mask. But that has changed because we've learned a lot more about the disease, right? And so now it's actually encouraged. There's a New York Times article that Krink sent me that's actually encouraging people to actually put on face mask, right? And the reason is we know this lives in the air, right? We talked about this, right? Last week, when someone coughs, for example, you could drop on something, but if you're close to someone, that might get on you. That's the whole reason behind the social distancing rule, right? It's around this idea of coughing and things. So if you feel sick, it's highly encouraged that you put on a face mask, so at least when you cough, it stays within. It doesn't jump up and land on the table or something.
So it's not even so much. It's not even so much like obviously, if somebody coughs, it's gonna protect you from that, and if you're coughing or whatever, it's protecting the other people too.
Correct. So it's even beyond that, right? So if you cough, from a face mask perspective, and you don't have a face mask, and you have a cold, and you sneeze, and it goes on the tabletop, right, or it goes on your hands. Right, I know Lisa has put on that gross face on, right? Like right. So that might go on. So there's two ways of why.
It's true. That's why we're wiping everything down here.
Correct. If I leave my
That's
home
why
without
all our
putting a face
manicures are
mask,
getting ruined from all these-
I get in trouble, right? So I need to put a face mask, not necessarily just for myself, but to protect other people, right? I might be a carrier of the virus and I sneeze on something and someone else touches that surface and then gets infected, right? So for that reason, I encourage face
Trust me,
masks.
everything here has been wiped down multiple times. Multiple times. All right, let's go to Susan right now. Susan, hi, you're on Hot 97. Go right ahead.
Hello.
Hey, is this Susan?
No, it's Carl.
Okay, Carl, what's your question or comment?
Well, I truly want to know if it's possible. When do you believe this will all end or come to a close end?
Good question. That's a question everybody wants to know. Dr. Manny, what about that?
It's anyone's guess, right? We know the incubation period for coronavirus is 14 days, right? So if you've been exposed, if you stay isolated for 14 days, then your risk of exposing other people actually goes down, right? And so that's the reason why we're saying everyone should stay home. If everyone follows the rules and everyone stays home, then we could actually reach the peak, and we know for a fact that okay, we've peaked out, and that everyone has a disease within 2 weeks. Then there'll be no one with the disease. But we know not everyone follows the rules, right? And so because of that, our best guess is we don't know. I mean, that's the actual answer. But to have a mindset, a roughly period, I mean, this would take a month or two, right? So this is not something that will be a couple of weeks still.
So this lockdown that we're in is not going to just be a 14-day lockdown. It's probably going to go on for longer.
Most likely.
Most likely.
Correct, because you look at places like California, they haven't picked yet, right? If you look at what happened the last 2 days, right, where we had numbers double within the last 48 hours to 1,000 more people, right? We have over 2,000 people today. If you look at what happened in China, for example, even though China actually went down in the last couple of weeks, they actually been spiking because people are traveling back to China, right? People are getting China and not getting people more infected because people are traveling into China.
Basically, everything has to just get shut down until they can get caught up with the people who are the most seriously ill.
No, correct. And to put this in perspective, you look at places like Spain and Italy, right? You have cases where like 700 people are dying per day, right? Just insane numbers, right? So we are not even there yet. So even in Italy, it's not picked out. In Spain, it's not picked out, right? And so you look at what happened to these countries, and they had it before us. And so I think we have at least a month or two ahead of us.
Oh wow, people don't want to hear that, but that's the truth. Let's go to Linda right now. Linda, hi, you're on Hot 97. Go right ahead.
Hi, how are you? Good morning.
Good morning. What's your question
Hi,
or comment?
I work for an essential business store, and we're still open, subjected to all these people still coming in. I was wondering, when is everything going to shut down?
Okay, that's an excellent question too. Thank you very much, Linda. Are we going to get to the point because President Trump was like, we're going to shut down, we're going to lock down New York, and then Governor Cuomo clapped back on that and said, no, that's not possible. The federal government can't tell the states that. It's going to be an act of war. He actually used that terminology, but is that really what's necessary?
Correct. I mean, if you
from a medical standpoint, not
correct.
politics aside.
Yeah, no, correct. From a medical standpoint, yes, that's exactly what should happen, right? Everyone should literally stay home and no one should get exposed, right? And then that's how you cut it. But it's not practical, right? It's
Right.
not practical to say everyone right now has all the water and all the food they need at home, right? So
Right.
the grocery stores needs to be open, right? We need to transport goods between states, so gas stations need to be open. Hospitals need to be open because people are going to get sick. So you can't literally shut down every single thing. But what we can do is look at what happened to other places. So let's look at China, for example, in Wuhan, right? What happened in China? Well, I mean, the whole Wuhan area and the Hubei province was actually locked down. People could not leave or enter, right? And so they cut down the disease. Today, people are going into Wuhan, right? And so people should travel. Yesterday, I saw pictures of people actually traveling back there. So those things happen. We could look in the future and see what happened to these places, and we could guess what happened. Right, so what we can do is the best we can do is mitigate things. 2 weeks ago, we went to New York. I went to any grocery store. You could walk in and buy whatever you want. Today, you have markers on the floor, right? You have
Right.
the long lines
And
outside
people
grocery
waiting outside, yeah.
Correct. So I think we'll see a lot more of those as opposed to having complete shutdowns of grocery stores. And this will be a new way of life. I want everyone to think about this, right? So this is not something that's going to change after the virus is over. This
Really?
is correct. I think this is like we talked about this, Lisa, last week. This is like the 9/11, in the healthcare space, right? This is a worse
Right,
than
because
that.
everything changed after 9/11. Before 9/11, you could walk into an office building in Manhattan. Now you have to go to a desk. You have to have ID. You have to get, there's security guards. There's barriers.
Correct.
All sorts of
Or
things.
going through
a
airports.
plane or even
Correct.
a plane.
Go through
right.
airports, right? Now taking off your
airport security.
shoes, taking your laptop, and we're getting wiped.
So annoying.
Correct. Just part of traveling today,
Right.
right? And so we get used to that. So I think going forward, for the very first time in the history of, in our lifetimes, where healthcare, we are going to be more proactive about healthcare, right? Because remember, there'll be no point where 100% of coronavirus is completely gone, right?
Right.
Out of Earth,
Right.
right? And so someone is going to have it at some point, and we know how contagious it is, and so we are going to be proactive, going forward. If you look at even in China today, you will see even though the rates have gone down significantly, which is where we'll be in a couple of months. People are still wearing face masks, right? It just becomes part of where you live.
I know, and I want to talk with you later in the show, towards the end of the show, just about the future and things that can be done in this whole concept of emergency preparedness. Because it seems like, with this mask shortage and this equipment shortage that we're seeing, it's really, we got to do better. We can definitely do better.
Because we didn't take it seriously, right?
Right.
Yeah, and so before, when you heard about what's happening in China, the idea was, well, China is not equipped enough, right? And so that's what happened. Then we heard about Italy.
Right.
And then he goes, oh, yeah, the Italians are not, probably not, they don't have the best health system. Actually, Italy actually has a very good health system, right? And if you look, so now it hit us now in the U.S., and we're like, hold on, what's happening to us, right? It's hitting
Right.
New York City, and it's
Right.
changing our lives. This is a global lockdown.
Right, they always used to go, America has the best healthcare system in the world. That's why people come from all over the world here to see our doctors.
And then we find out we don't even have masks and gloves for
our
the frontline
doctors
workers.
and
Correct.
for our nurses and for our
Scary.
frontline workers. Okay, let's take a quick call here. Let's go to let's go to Daniel right here. Daniel, hi, you're on Hot 97. Go right ahead.
Hi, good morning.
Good morning, Daniel.
I am a healthcare provider for autistic children. I'm an ABA therapist, and part of my job entitles me to go to other people's houses in order to give these kids their home-based sessions. Now, I'm just wondering if that is a safe environment for me to be in order to slow down the spread of this virus, and also would I be qualified as an essential worker in that case?
I believe you are. There's an actual list. If you go to New York State at NYS.gov, there's a list of what's considered essential, and I believe that you would. I can't say for sure because it's a home care situation, but let's see what Dr. Manny has to say in terms of what advice can you give him in terms of protect, because you have to be close to the child also too. It's not like you can sit 6 feet apart and
Yes, exactly.
and
right.
really be with them. It's literally a hands-on type of job.
No, it is, and you are an essential worker, right? I mean, these
Yeah.
kids need you, right? And so
Right.
your services are extremely valuable, right? Let's not forget that for everyone's baseline, everyone is completely different, right? We talked about mental health last week on this same show,
Right.
And I think those kids need you and they depend on you and your services, which is great that you're actually going out there to help them.
No, I think it's fantastic too. But
Fantastic.
should he be wearing a mask? Should he ask for the other family members to leave the room when he goes into the home? Should he?
Of course.
Any tips and bring his own sanitizing stuff? I would say this to all. We're getting a lot of calls from frontline workers, essential workers. If I'm understanding you correctly, and I would just say, if you're not getting what you need from your job, just try any way you can, by any means necessary, to get that protection for yourself, because you need to keep working.
No, you do, and I think you should look at every time you walk into any home as that's a possible risky area, right? Because people are coming in and out, right? And that's on one side, the environment that you're walking into. But don't forget, you are also going from house to house to house, so you're actually putting those kids also at risk as well. You put yourself at risk, right? So it's on two sides here, right? So the best way to do it is to assume that everything around you is contaminated, right? And you become more proactive about it as opposed to being reactive.
Joining me in studio is Dr. Emmanuel Fombu. He's a medical doctor, has an MD and MBA, best-selling author of the book, The Future of Healthcare. He's also a medical futurist, practicing physician. Also joining us on the line is Dr. Shaneen Lalani. She's an internal medicine hospitalist at community hospitals here in New York City. And one of the big questions, Dr. Manny and Dr. Lalani, do we have her on the line here? Okay. Oh, where's she? Okay. Here we are. Okay, great. Now we got Dr. Lalani on the line. Dr. Lalani, good morning. Thank you for joining us.
Yes, thank you for having me, Lisa.
So listen, we're joined in studio also by Dr. Manny Fombu, and one of the questions we keep getting from the callers is about this: who should get tested first of all? Can you tell us about that? What do you think about that?
Yeah, sure. So CDC has created some guidelines and what we refer to them as a priority list of patients that have to get tested or that should be getting tested because of the resources we have regarding testing. So the first one on the list, priority-wise, are hospitalized patients that are admitted into the hospital with really severe symptoms, and we're trying to figure out what is it that's causing their disease to be so severe. And so those are the number one priority. The other one that are on the number one priority list are healthcare workers, especially the ones with symptoms coming to work in the front lines. They have to be tested because we have to make sure that first they are safe, and also that they're not spreading the disease to other patients that they're taking care of. So that's the number one priority of patients listed on their list.
All right,
the
and then
second priority, yeah.
No, go ahead. I'm sorry.
Sure, no problem. The second priority is on the CDC website specifically says patients that are high risk of complications. So those are the ones that are, 65 years and older, the grandmas, the grandpas, patients in nursing homes, the ones that are immunocompromised, with cancer, lung disease, heart disease, kidney disease. So those are the number two priority. And then the third one is, individuals in the community. And it specifically says if resources allow, especially individuals in the community that have a high hospitalization rate in the community. So that's kind of the priority list.
Okay, but in terms of, let's just talk about symptoms real quick, okay? Because you're in the community hospitals. What about the symptoms?
Yeah, so, there's definitely trends we are seeing symptom-wise after taking care of several of these patients with COVID-19. The number one symptoms we are seeing is fever. A lot of these patients have very high fever. Anytime there's a viral infection in your body's response is a very high fever level. Fever is considered anything above 100.4, and these patients are coming in with 101, 102 fevers. And the other most common one we're seeing is cough and difficulty breathing. But I have to tell you that after seeing a lot of these patients, we're also starting to see other symptoms, what we refer to as gastrointestinal symptoms, which are diarrhea, abdominal pain, cramping. Some patients are coming in with a loss of taste, a lot of loss of smell. But the symptoms, when we get worried, the symptoms we get actually very worried about are the ones where they start having trouble breathing. So, they feel like, okay, their lungs are starting to get worse. They're having this persistent pressure and chest tight pain. They're starting to get confused, especially elder adults. And then they start showing signs of what we call hypoxia, which is low oxygenation levels with bluish lips, change in color. So those are the most common symptoms we're seeing.
All right, Dr. Lalani, thank you so much for being with us. We know you got a busy schedule there, but thank you so much for being with us and helping us understand it and get our way through this. We appreciate it.
No problem. Thank you, Lisa.
Okay, thank you. All right, let's go to Steve. He's been hanging on for a long time. I know people are hanging on for a long time to get on, so Dr. May, let's try to take some telephone calls. Steve, good morning, and thank you for joining us. What's your question?
Good morning, Lisa. Good morning, Doc. I just kind of wanted to see if you guys would address a question for me. So I'm a frontline, I guess, essential employee. I work for I'm a supervisor for the police department. I'm an officer. My fiance is a nurse at a pediatrics ER. And my question is, my fiance is currently pregnant. She's about 25 weeks, and she's not due till about July 12th. So now the hospital, under these circumstances, obviously with the coronavirus and whatnot, they're not willing to sign her out on medical just yet because it is too early. However, she is deemed to be immunocompromised. So we just don't know what to do, whether she quits her job. Should she? I mean, she doesn't have any sick days or anything like that to give her paid time off, which she's already blown through. They gave her 12 days, and she's set to go back to work tomorrow. And they're running out of equipment. They're running out of masks.
And she's 6 months pregnant.
Yeah, she's 6 months pregnant. So we just don't know whether she just goes to work, toughs it out, and hope for the best, or because
you mentioned she was immunocompromised, so she has a separate health condition.
No, well, I guess again, I'll leave this up to you guys. I'm no medical personnel, but they say that obviously she's pregnant.
That you're more susceptible.
Yeah, I guess that's what they're saying, is she's more susceptible.
But she doesn't have any other condition.
No,
she doesn't have any
She was tested and came back negative. Thank God. But she's just going to keep going to work and be exposed to this. I mean, she's at an ER.
Are you concerned about her health or the health of the baby?
Or both?
Well, both. I mean, both. Really, both. I mean, I don't know. I guess the CDC hasn't said anything about how it affects a pregnant woman or the fetus or anything like that. So we're concerned about the baby, or when when it's born, if she's going to be, it's going to be a girl, she's going to be sick,
Yeah,
congratulations. Thank you. I mean, it's unfortunate circumstances, but I mean, it is what it is at this point. We just don't know how to go forward with it because of the fact that, she is a healthcare worker. Her hospital now that she's working at, they just said that the adult ER is going to, the pediatrics ER is not going to start taking adult patients up to the age of 30. So now she's going to be exposed to the adult patients as well. It's something that we just don't know what to do.
Steve, listen, first of all, we can't tell you what decision to make because that's between you and your fiance.
Yeah,
or your wife. And congratulations on the pregnancy. And thank you for the work that you're doing as a first responder, as a police officer, because we know the NYPD and some of the other departments around the country have suffered some losses of officers as a result of this coronavirus epidemic. So thank you for being out there answering the calls and making sure that large groups are not getting together and that type of thing. But Dr. Manny, in terms of what we know about the disease and how it affects pregnant women, and does it affect the unborn child? Maybe that'll help Steve a little bit here.
No, correct. So the first thing is, remember, this virus came about December 31st, 2019, right? So we don't have very new. So we don't have enough information about that. That we could say specifically in COVID-19, what happens in pregnant women. That's one of it. But we do know that COVID-19 is from the coronavirus family, right? So we have things like SARS that we've looked at, right? MERS. Middle Eastern respiratory syndrome. So we have other viruses that are within that family that we've seen that have been around for a longer period of time. And what we do know is, one is it doesn't cross. We don't have any evidence today that says it crosses to the child. Right?
So it's not like alcohol. It's not like drugs.
Correct.
Like these drugs where we see the babies being adversely affected by that.
Correct. So we don't have any evidence to support that, right? And it hasn't happened in other coronaviruses that they cross from the. Remember last time I talked about this thing called the blood-brain barrier?
Right.
That prevents some viruses and some kind of bacteria to actually transport to the baby, which is a good protection that you have, right? So from that perspective, we don't have any evidence to say the baby is at higher risk, which is good. At the same time, I do think that, just being pregnant enough without anything around is enough stress.
100%.
Correct.
God bless her.
Right, correct. So it's a very tough period of time, and the stress of it doesn't necessarily put her in a particularly good situation. So I think policies need to be put in place to actually, take care of our, frontline workers to make sure that they are comfortable personally, right? She should not be worried at this particular time, being pregnant, worried about taking some time off. If she needs to.
And that's a decision that she and her husband have to make.
Correct.
What's the priority there? Because there's with this whole thing, there's no guarantee.
Correct.
At all. And then I want to come back to this because again, more calls are coming in at 1-800-223-9797. If you're an essential worker and your company or your employer, like some of the home attendants, they're not giving you masks or giving you gloves, I would do what I could do, whatever I can try to do to try to get my hands on ththose.
Correct. I think you should try, but fortunately, there are very nice people out there, volunteers, collecting some of these masks. So please, you might contact one of these organizations online. Just Google it, and you find some of them, and they might be able to get you a mask or something, right? But it's important for you to protect yourself.
The mask and the gloves.
Correct. Because even if you get sick, if they don't protect you and you get sick, guess what? Now you're out of work, and then now we have more patients coming in, and there's no one to take care of them. So it's very important that you're healthy.
Exactly, because they're taking care. They're really frontline too.
Correct.
Very much so. All right, let's go to Nina right now. Nina, hi, you're on Hot 97. Go right ahead.
Hello?
Hi, Nina, you're on the air. Go right ahead.
Okay, great. So
Nina, listen to it. Please listen to us on the phone, not the radio, okay?
Okay.
What's your question or comment?
My question is about the guy who just called in saying that there's no... Okay, so basically, somebody was born with babies that had COVID, and somebody just said that it's not possible to transmit it to your placenta, and that it's absolutely possible. It is absolutely possible, and it's wrong for them to be saying that on the air. It's completely wrong.
Are you a doctor?
No, I'm a nurse.
A nurse? Well, the baby a baby who is born can catch it.
Correct. So what I said was that the
unborn child.
The virus is very new, so we don't have a lot of information about it. But what we know from the coronaviruses, like the SARS and the MERS that happened previously, we have not seen cases of them transporting through the blood-brain barrier to the pregnant mother. So there are certain things that transmit. They're called torches, right? Like toxoplasmosis. If a mother is pregnant, for example, they say don't spend time around cat feces because toxoplasmosis can be transmitted that way, right?
Right.
Herpes virus transmits.
Don't drink alcohol.
Correct.
All these things.
Herpes virus will go. Syphilis, for example, would travel between the blood-brain barrier.
HIV.
Correct. And what I'm saying is HIV doesn't. So HIV.
Oh, it doesn't.
Correct. That's why if a mother is pregnant, you have HIV, you could have a C-section, and the baby could get on antiretroviral drugs, and they could be negative. Testing positive, if a mother, for example, is infected with the coronavirus and the baby is born, the baby might test positive, but they have antibodies for it, right? So a test is showing antibodies to a particular disease. You know, for the first 6 months of life, the baby has the mother's antibodies, right? And so that's why babies are protected for that period of time. Then after that, you need to build your own immune system as a kid going forward. So at this point, we don't know. There's no evidence to support that it transmits.
Right.
Because other coronaviruses
most likely not, but we don't know for sure.
Correct.
To sum it up.
Correct. Because, like I mentioned, some things do transfer, but it's a blood-brain barrier that prevents things. We have no evidence that coronavirus does transfer.
Okay. Let's go to David right now. David, hi, you're on Hot 97. Go right ahead.
At this point, we don't know. Hello?
Hi, David, you're on the air. Please turn your radio down, and then we can, we're happy to take your question.
Basically, I'm an exterminator. We're in and out people's apartments and consistently in different locations, not just in one building, and we're in the different people's apartments through basically the whole building. If I have like a 24-unit apartment building, we're going from apartment to apartment, knocking on people's doors. Everybody's just completely forgetting about exterminated pest control technicians. Is it safe that we're, being essential workers, is it safe for us or other people?
All right,
good. We're in contact with people and people's surfaces, and
what about that?
Everybody just tends to forget about like pest control work, and I hear everybody else essential, but we're in and out people's apartments.
You have to have the apartment buildings in New York City. A lot of them, they have to have that in the building every month, like on a regular basis.
And not even just that. With tri-state areas, sometimes I work in New Jersey, sometimes I work in Long Island. I'm everywhere. So it's like
All right,
And then
David. Let me get an answer from
Okay.
Dr. Mann because we just got a couple of questions. A couple of minutes. Thank you very much for your call. They're going from apartment to apartment to apartment. Some apartment buildings 200 apartments or whatever. What do you think about that?
That is one of those. It fits in that same criteria what we discussed earlier, right?
Right.
About protecting yourself, looking at every surface around you as being possibly contaminated. So the best thing you can do is put on your face mask, put on gloves, and make sure you wash your hands.
And continue to do your job.
Correct. And the whole idea here is is prevention, right? That's the mindset. The mindset is to prevent things. Remember, there's nothing in life that's 100%.
Guaranteed.
Guaranteed, right?
And you can't really say, is there any way that even medical experts like yourself can say it's safe or it's not safe? You can just say this is less risky, this is more risky, this is how you reduce risk, right? Like harm reduction or?
No, correct. And so just like, even from the previous question, we talked about the pregnant mothers, for example, right? Is it possible that maybe one mother, something crossed? Of course, right? But is it the norm, right? So it's about risk and mitigation in risk, right? And is it something that's very common or it's not common? So that's why you go about doing this thing. There's no 100% guaranteed thing that this doesn't happen, right? So we have to go by that. But just be safe out there and make sure you protect yourself.
All right, let's real quick. Do I have time, Stas? Well, real quick. Okay, let's go to. All right, I don't know what your name is, but you're on the air. Go right ahead. Is it Neek?
Yes.
Oh, okay, great. All right, that is right. All right, thank you for joining us, Neek. What's your question or comment?
I'm currently a postal worker, so as far as essential employees, we're considered that because we're literally going to house, delivering medications and everything. And I know that we're more at risk because we're literally going to every single place in the country right now. And what's the best thing that we can do for the postal workers to be able to really not get infected? And can we even effectively do our job, without coming in contact with this virus?
All right, excellent question. Dr. Manny, what about the postal workers? She has, because a lot of those prescription medications come by mail to people. They get the mail to their homes or to their apartments. And she's asking what can she do as she has to deliver these things to people, have a pretty good chance of being sick because they're getting medication delivered to them. What can she do?
It's one of those things where you most likely want to get some kind of hand sanitizer, right, with you, and it's very important as well. I'm like I shop a lot online, and I get a lot of boxes delivered as well. And we know that the virus can actually live on cardboard for about 24 hours.
Oh, really?
On cardboard, correct. So you could live on a surface like that for a long period of time. So even if someone had the virus and they touch a box and they give it to you and you hold it, and you're going from door to door to door, and you're probably high risk because you're meeting people that are probably sick, right?
Right.
And so first thing, I'll probably put on a face mask, and I'll make sure that I wash my hands. But the best thing is probably put on a glove. And if you put on a glove, put on a face mask, make sure you don't touch your face. Just make it like, if you're going doing rounds, I don't expect you to wash your hands after every home you go to, right?
And
it's
those,
not practical.
Exactly. And those latex, the other thing too is those latex gloves that they, that come in like a big box that you pull out, that not the super thick ones, but like that. Is that enough to protect your hands for something like what she's doing? So she could have a couple pair with her maybe.
Yeah, correct. So if you have a glove on or you don't have a glove, in this particular case of a postal worker, right, the key thing is the glove does not protect you from actually getting infected. The idea is don't put it on your face.
Right.
Right. So the glove is easier because you have to wash your hands every single time. You could just pull the glove off, right?
You
and wash
can
your hands.
do your route or do whatever you have to do
Correct.
your deliveries.
Correct.
And then
If you have a glove and you touch a box that's contaminated and you shake someone's hand and you take the same hand and put it on your face, you might get infected. Right. So the idea here is try not to touch your face.
Let's go to Romero right now. Romero, hi. You're on Hot 97. Go right ahead.
Hey, Grand Rising, everybody on the radio station. Thank you for this opportunity to get me on the call. But I wanted to know. My question is it airborne? Because people are outside, we're walking, no mask, some has masks. But I would like to know if it's airborne, like is it in the air staying around us?
All right,
as we moving?
Excellent question. Dr. Manny, what do we know about that now? Because that kind of changed a little bit too, right?
Correct. So we do know that, the virus lives in the air for about 3 hours, right? It can live in the air. So you have mixed data on this, right? There are people that say, well, this is completely airborne, and then but then some people say, well, it's in the air, but then it drops on the surface. That's what we should be concerned about. I think from looking at data around this, I think yes, it is slightly airborne. How long it could last in the air and how far it can travel is something that we still need to understand a lot more. But that's the whole reason behind the 6 feet social distancing rule, right? If it was not, if we didn't think there was a risk for being airborne, then there's no reason why we shouldn't be in crowded spaces.
Right, exactly. And the moisture, what they call in the moisture droplets, that supposedly they were like, oh, first that's the only way you could get it, but the only way those are getting put out there are through the air.
No, correct. And that's one of the great things about having new viruses like this in the air is as time goes on, you get a lot more information about it, right?
So the answer would be, yeah, you need to be careful about that. All right, let's go to Trina right now. Trina, hi, you're on Hot 97. Go right ahead.
Hi, good morning.
Good morning.
My question is, if one of my coworkers that I work with every day found out that they have the virus, do I need to be tested? Do I need to quarantine myself? Like, what would be the process for me to do?
Oh, excellent question. Thank you very much for that. Thank you very much for that call. She works with somebody who tested positive for coronavirus. One of her patients, does she need to quarantine herself?
I think she should get tested. You fall in that category of being tested, right? The first category before everything changed was if you were in contact with someone that is positive, then you should get tested. And I think if you were interacting with that person, yeah, I think you should definitely get tested.
All right, let's go to Ken right now. Ken, hi, you're on Hot 97. Go right ahead.
Hello?
Hey, Ken, you're on the air. Go right ahead.
Hi, how you doing? My concerning question is this. Everyone is talking about wear your mask and your gloves, and I see that being done every day. But basically, they're keeping them on all day. I walk in the store, people have the gloves on, they leave out of their store, they take the possible contamination from one facility to the next facility. I mean, I think we should be telling people to change the gloves frequently.
Correct, and that's what they should be doing, right? And which is the catch-22 here. You said people wear gloves. People wear gloves and they think about just themselves, right? My hands are protected and they don't worry about what happens to other people, right? So remember, this is one of those diseases. It's not about you only, right? It's about you and the people around you.
We're all in this together.
Correct. Is that mindset that we have, right? And so the idea here is, the way to think about this is don't just think about, am I going to get sick, right? You think about why do we have to, self-isolate ourselves, right? Why is everyone locked up at home? It's not because we're worried about ourselves getting sick. It's the fact that we might pass this on to people that are more vulnerable.
Right.
That this might become fatal to them, right? Like we talked about this, majority of people that have the virus don't get sick and they don't die from the disease. Okay, so don't panic.
So don't feel as you're seeing. No, this is an important
Correct.
point because we hear these numbers. We hear these numbers going up. Pretty much everybody by now has had somebody either they work with or a place where they go where somebody has tested positive for coronavirus. It's not Ebola. It's not a death sentence. Obviously, for people who are already suffering from medical conditions and health problems, it's very serious. But is that number that they had originally about the vast majority of people who even test positive for coronavirus will survive it?
No, correct. So
and have no symptoms.
Correct. At the beginning of the show, we had these numbers, right? Where we have over 120,000 people that are positive for coronavirus infections, right? And we have 2,000 deaths, right? So even if you do the math, right, this is like very small percentage of people that actually die from this, right? And so the overall sense is the reason why we have to be alarmed is because we want those amongst us that are immunocompromised, to live. We don't want them to die because we put them at higher risk, right? And even if you're immunocompromised, does not mean that if you have coronavirus, you're going to die, right? So or just because you're over 65 or 70 and you have coronavirus does not mean you're going to die. It just means you're higher risk.
Right.
So we don't want those people to get sick and expose them to this, right? And so the whole idea here is how do we contain this so we can go back to our normal lives? Let's stay home, right? And only unless it's necessary for you to be out, then you go out. But if you do that, then the sooner it is for us to get back to a normal life, to go to concerts and hang out in the parks. That's what we want to do.
Exactly. So following the rules gets us there. All right, let's go to Henry right now. Henry, hi, you're on Hot 97. Go right ahead.
Yeah, good morning, Dr. Fombu. I know you're a champion of preventive medicine. And my question is, we've heard a lot of preventive measures from a hygienic standpoint, like wash your hands and sanitizing. However, we've not heard much from a nutrition standpoint. So, are there any dietary recommendations besides, say, vitamin C intake that we should be looking out for?
Oh, excellent question, Henry. Thank you very much for that. What about that? Because there's all kinds of, everybody has their own. A lot of people have their own routines for dietary recommendations. But are there anything that you would recommend? I mean, we definitely have heard about water because it's respiratory. It's good to stay hydrated. That's a big thing, right?
Correct. I think that's Henry Fossung, my buddy from high school. I think I could recognize the voice.
All right, shout out to Henry. Okay.
Yes, hi, Henry. He's out of Chicago, actually. But I think one of the key things here, especially in New York, when I said majority of patients that died had, cardiovascular disease and diabetes, right? So in general, what you eat, especially during this period where people are stuck at home, they have light exposure, right? You're stuck in one particular place.
Right.
It's very, very important for you to eat healthy. The default piece is just to eat junk and not take care of it. But vitamins, of course, are very important in terms of boosting up your immune system. If you do get sick, right, that's very important. So eat your veggies as usual. Eat your proteins, but make sure you also eat healthy and exercise because that's very important, not only for your physical health, but also for your mental health.
No, definitely. And just because you're at home and you can't go to the gym, and if the park is too crowded, you don't want to go out into the park because there's too many people out in the park, there's tons of exercise videos on YouTube.
No, correct. And I think a lot of people are going to gain weight over the period of time, like being at home, right?
Yeah.
People can go outside. So being able, even walking back and forth in your apartment. I know we're in New York City and you don't have huge backyards or mansions to walk around, right?
Exactly.
But try to exercise, eat healthy. If you need to take extra vitamins, please do. Eat your veggies,
It
juices.
can't hurt. It can't hurt.
It cannot hurt,
Keep
right?
your system as clean as possible and as healthy as possible.
Correct. And when you grocery shop, make sure you get some fruits as well, right? Oranges, grapes, and just some of those things to snack on.
I stocked up on all that. Let's go to Idris right now. Idris, hi, you're on Hot 97. Go right ahead.
Hello?
Hi, Idris, you're on the air. Go right ahead.
Yeah, I'm an Uber driver. I just want to ask the doctor the most important how we can prevent ourselves as a Uber driver.
What about that? Because what would you recommend to him? Because he's there, he's got different people getting in and out of the car. There's no plastic barrier like in the yellow cabs in most of those cars. What about that, Dr. Mann?
Correct. And when people get sick, they call Uber.
Right.
Right. So
To go to the hospital.
To go to the hospital, right? Especially if you pick up someone from the hospital, drop them off. I'm sure it's an area of concern. So I would think one of the key things our advice is one, have a face mask on, having also hand sanitizer. I think is also very good because people talk to you sometimes when you're there, right? And,
No, absolutely.
And the 6 feet rule, it doesn't necessarily apply unless you're driving a limo. If you're driving just a regular car, you don't have 6 feet between the person in the back seat and you in the front, and they're talking directly right to you, and you're having a conversation back and forth with people you don't know and tons of people. So having a face mask, I think, will be very important if someone's in the car and speaking or if they're sneezing. And the next thing I'll do is also, we didn't know that this lives on different kind of surfaces for a long period of time. So even if someone is behind your car and you have a face mask and they sneeze, for example, and it goes behind the seat of your car, or someone is sitting there, your hands on the seat, right? Those are areas that they could contaminate.
Right, and they're
things.
coming in the car with a bag or with a, whatever.
Correct. So what I'll do is also clean, the door handle
With the disinfecting wipes.
Disinfectant wipes, right? And we have technology around this, nanotechnology that actually protects and lasts a long period of time, right, around this. So you could do things like that, like make sure you use very good, desanitizers to clean up. But I'll clean up regularly, even for the sake of protecting your other customers, right? If a customer leaves the car, maybe just wipe down that door segment of it, right? But that's the best you can do.
Exactly. Get some of those wipes, those big tubs of wipes. By the way, they have them at the Harmon. I got to shout them out because shout out to all the girls at the Harmon Face Value behind the counter on 6th Avenue at 22nd Street in Manhattan. They're limiting them, like a lot of stores are limiting, but they have those double packs of those Lysol type of wipes. They're store brand and they're really good. So we're just letting you know that.
That's correct. Yes. So just have like a wipe come in, and actually, if you have some of those wipes in the car and before someone gets in, just pass it out the window for them to wipe their hands before they get in the car.
Oh, that's a great idea.
That's a great
too.
idea, right?
Or like those little package ones that we have right here in the studio.
No, correct. Yes, so just pass them out the window and wipe your hands so that you're good. So that if you're comfortable, open your door is safe, and then when you put your hands on your seat of your car, you're fine as well.
That's a great idea. All right, let's find out what's happening with the with Rikers Island, with the New York City jails, and let's go right now to Tina Longo. She's the attorney in charge of criminal defense at the Legal Aid Society in New York. Tina, thank you so much for joining us.
Good morning. Thank you for covering this really important topic.
No, we really appreciate it. And do you pronounce your last name correctly, Luongo or Longo?
Yes, Luongo.
Luongo. Okay, great. All right, just want to make sure we get it right. Tina, a lot of questions from people. What are you finding out about the spread of the coronavirus in the New York City jails?
It's unfortunately spreading exponentially. As of 5 o'clock last night, we've been tracking the data. Our team at Legal Aid Society has been tracking the data that's available publicly, the very little information that's been available publicly. But as of 5 o'clock last night, the Rikers Island ratio of people who have tested positive for coronavirus is 7 times more than New York City itself, 10 times more than New York State, and 77 times more than the rest of the United States. So therefore, Rikers Island right now is the epicenter of the highest rate of positive testing for that population in the entire world. And that's startling, and it has to demand more action.
Tina, we heard reports and some stories that they were not allowed. There was not soap in the housing areas at Rikers Island. That people had to use commissary to get soap.
That's right.
Is that correct?
That's right. That's right. 3 weeks ago, we began to start when the information started to build, and the first correction officer was tested positive. We began to get calls through our prisoners' rights hotline from people who are incarcerated saying, "I have no access to soap." The Department of Correction is saying, the officers are saying that I have to buy soap through my commissary. There's no hand sanitizer because, remember, in New York City and New York State correctional facilities, hand sanitizer that has alcohol is a prohibited item. And it changed for the state, but it did not for DOC. So we reached out to the Department of Correction 3 weeks ago and said, you must change all of this. Otherwise, you are going to have a massive health crisis on your hands. The answer was not that we heard back from the commissioner, but that we heard back from the head of the legal department in writing to say, we are taking care of it. Days later, they issued a plan, a quote plan for stemming the spread, and up until now, there's been no public information for family members who are worried about their loved one.
Well, Tina, that's why we're so glad to have you on the show, because we've been getting a lot of calls here at Hot 97. I've been getting a lot of questions on my social media too, and I want to bring in Dr. Manny, because that's incredibly serious, because people may think, well, they're isolated, they're on Rikers Island, but they're not really isolated.
They're actually trapped, right? Because you have, even if let's say you were in jail before coronavirus came about, right? And you were not exposed. You have correction officers that are leaving every single day and going back home and being exposed to the day-to-day parts in the outside world.
And up until recently, visitors.
Correct. And visitors. And so you are literally trapped in a particular location, and then now people come to you, right? And so then you have less rights to actually, you can't necessarily maintain 6 feet, right? Social distancing rules is beyond your control.
Not at all. Definitely not in Rikers.
Correct. So they definitely need more resources to actually protect themselves.
And then in terms of the hand sanitizer, because Tina, that was because there was the alcohol content in the hand sanitizer, right?
Right. And look, we have to recognize, and I don't think that the New York City Commissioner, Department of Correction, who, by the way, has been invisible through this entire thing, not a public statement, not a statement in the press, nothing. You would think that as a New York City who claims to be a sanctuary city, that our commissioner of corrections would be out in the public on your radio shows, in the media, telling people that her job is to protect the people that are there, and yet she's nowhere to be found.
Well, we would like to extend an
So
invitation.
that's really startling.
No, we'd like to extend an invitation, but let me come back to the inmates themselves. So these high infection rates, and then in terms of, is there any testing being done on Rikers Island at all? Because we have seen inmates, there are inmates testing positive. There's correction officers who are also at high risk too, because they're going into this population, then they're going back into the community, they're going back to their families.
Right.
There's correction officers that are at very high risk as well, too. But in terms of the testing, like if somebody feels really sick, are they removed from the general population? Are they isolated? Is there anything like that going on?
So Correctional Health Services is on the ground to try to deal with figuring out how to isolate. But again, as the doctor said, there's no ability to socially distance. There's the bathrooms are used by multiple people at multiple times. In and of itself, before COVID, Rikers Island has been an unhealthy situation. We've been litigating that for 40 years. And so you might imagine that, sure, there is healthcare being done, and there's very limited testing being done. But the fact is that it is a powder keg for spread. And every single day those numbers go up, and we've got to take some bold action here. So we have, the mayor has released some people. We
That's
have
what I wanted to ask you
brought
about.
3 lawsuits.
Right. What about? Could I ask you about that? What in terms of this policy of releasing inmates? And also, I think they're trying to do that in some of the state prisons. What do you think about that, Tina and Dr. Mann? I want to get both your opinions on it. Tina, what do you think about that? Releasing people who are maybe at high risk too.
Yeah, no, that's exactly what we have been fighting for. We filed 3 lawsuits, and the mayor has for people who are sentenced already has implemented a work release program, and we appreciate that, but we need to do more. The state is woefully lagging behind. The Department of Correction and Community Supervision that manages the state facilities haven't done enough. There's no clemency being done for our populations who are there, who are elderly, vulnerable, and sick. So the governor's got to start moving on that. More has to be done, and it can be done, and it could be done in a way in which I think stops the spread and also increases public safety in that our communities are safer as well.
For everybody, too. And then, Tina, in terms of can you just give us, because we're up against the clock here a little bit, but can you just give us the any idea on what's going on in the prison system, in the state prison system? Because we're hearing a lot of concerns from families.
Exactly. Yep. So for family members, look, we keep putting the pressure that the governor should issue clemencies, that we should be doing release similar to what's happening here in New York, but on a grander scale. There's very little public information coming out of the state system. We don't know the rates. There is no public data available, so it really is walled off. Again, our Prisoners' Rights Project are on the ground trying to push and figure out what strategies we should use to get people home.
All right, we're going to try to get some answers from the officials, and hope to check back in with you. And
Please
also,
do.
Your website. I want to give that out to people. If they go legalaidsocinynewyork.com/COVID-19, legalaidnyc.org/COVID-19, there's the graph and there's the daily tracking of what's happening in the city jails in terms of the coronavirus cases that are happening with the inmate population. So Tina Luongo, attorney in charge, criminal defense at the Legal Aid Society, thank you very much for keeping us informed, and we really appreciate it.
No problem. Thank you.
All right. Thank you so much. That's incredible with the prison. Manny, what do you think in terms of from a public health policy? That's got to be, the inmates are usually last on the list of priorities, but really should not be last in this crisis.
No, correct. And I actually listened to the governor of California talk about the exact same kind of issue, right? And so one is, if you are letting people out of prison or jails, you could test them to make sure that they're not positive, right? Because you might
Right.
get infected and then you let people on the streets and then it becomes worse. That's one. Two, you have to make sure these people have housing as well, right? Because not everyone leaving jails has like homes to go to.
Right.
It's especially at this particular time, especially in New York City. So being able to take care of those people and make sure we have the right resources to take care of them, make sure they are safe and protected, I think is something else we need to look at.
All right, 1-800-223-9797. Let's go to Jen right now. Jen, hi, you're on Hot 97. Go right ahead.
Hey, how you doing? Good morning, guys.
Good morning. How are you?
Good. I have a quick question. Social media, they have some home remedies: boiling water, breathing the vapors, and also the hair blow dryer. Putting it by your nose and breathing it in, and kind of killing the virus or helping out. Is
The
that
hair
true?
dryer? I have one of those Dyson hair dryers, which is like 90 miles an hour. That thing would just blow my.
Yes.
Forget about it. That was like a weapon. So the steam vapor to help you breathe. Okay, let's see what Dr. Manny has to say. Any others, Jen, that you've seen out there? You heard about?
I've heard of drinking hot teas, and supposedly the virus can't survive in the heat.
Oh, that's another one we've been hearing a lot. All right, let's see what Dr. Manny says. Okay, first of all, this making your home steam vapor by boiling the water over a pot and then breathing in the steam. Is that good for you? It's got to clear your head.
It does. So the same things that you do when you have a cold, for example, right?
Right.
Those things will work. But I've seen a lot of those videos. The challenge is they tell you that it kills the coronavirus, right? And I've seen
Right.
people make bold claims like, oh, put garlic and ginger and some honey, and then you inhale the vapor, and look, the virus is gone, right? That's not so. The same things you do normally when you have a cold. We all have colds, right? We know what
Right.
happens when you have a cold.
To-
Like having
totally.
steam and put like a towel over your head and then
Right.
inhaling that. Yeah, of course you feel a temporary relief. But in this particular case, remember, if you get to the point where you're actually that congested, this is advanced disease,
Right.
This is when you had fever, you had your coughing, your dry cough, right? And then now you have pneumonia, which at that point, with your lungs that congested, inhaling, steam will not help you at that point. But this is advanced disease.
Right.
So hopefully you don't get that far to begin with.
And then the hair dryer thing, I definitely wouldn't recommend that. I think that's just not. I don't know.
Correct.
What that's
And
gonna
so
do.
that's what I tell everyone to just think about it. What do you do to relieve yourself when you have a cold? This is a virus, right? I mean,
And some
it's-
people like tea with honey. There's a lot of people that swear by green. I swear by green tea.
I love green
I always
tea.
feel better with a green tea. The ginger,
Yes.
the Caribbean community, our Caribbean community, which we love so much here in New York, they're very big on the whole ginger thing and everything.
No, correct.
And these ginger drinks and.
No, correct, and I'm big into that too, right? And so my sister actually studied holistic medicine for some time before she got into traditional medicine. And the argument here is, I'm not against the idea of, do I think ginger helps when you have a cough? Of course it does with a cold, right? I mean,
Right.
these are things that we use on
The
a day-to-day
idea is to
basis.
be as healthy as you can, so you
Thank
don't
you.
get sick in the first place.
Don't
right?
get sick in the first place, yes. And if you do get sick, yes, steam will help you, get out some mucus. But if you have pneumonia, steam is not going to help you. And a lot of these remedies online don't help you. Remember, there's no cure right today. I mean, like no cure that has been tested and shown that it helps in coronavirus. We could, help with the symptoms, like help make sure that takes care of, and then your body heals naturally. If you have pneumonia, of course, then we have ventilators to help you breathe, right? But that's not the case. Another question was around heat and the virus.
Right, does the heat kill the virus? Because people are going, oh, I hope it's 70 degrees again. Like we had that really hot day, last week. And because when it gets really warm, it's going to kill the virus.
Correct. So now we're in winter, and in Africa right now it's summer, and I'll tell you that this disease is spreading rapidly in sub-Saharan Africa. Right? If you look at places like Cameroon, Nigeria, it's spreading.
Wow.
And they currently have hot weather. So if that's the question of what we're thinking in the summer, would it stop? No, these countries actually have it.
And the hot weather now is bad because everyone just wants to go outside. Everyone's got cabin fever, and they just want to go out and.
Correct. Look at Florida now, right? If you look at the rates in Florida, Florida is actually picking up quite well. I have friends in Florida now that have 90-degree weathers and 80-degree weathers, and the rates in Florida are not slowing down; they're actually going up.
And the governor of Florida trying to keep out New Yorkers too.
Correct.
We're all in this together here. Let's go to.
We'll survive.
We'll survive. Let's go to. Let's see. We got AR right now. AR, hi. You're on Hot 97. Go right ahead.
How you doing? I'm calling from Queens.
Okay.
Now, are we hearing that there's COVID-19 now inside Rikers Island?
Oh, we're more than
Meaning
here.
people have it. People have it.
We're more than hearing it. There have been correction officers that have tested positive, and there's also been a number of inmates that have tested positive.
Okay. And are we releasing prisoners that have low-level offenses?
Yes, sometimes they're trying to. Some of them, yes. Okay, I guess you just hung up. All right, let's go to Leah right now. Leah, hi, you're on Hot 97. Go right ahead. Oh, this is a great question. Leah, go right ahead.
Hi, good morning.
Good morning.
I was listening earlier when the lady
Hey,
was
Leah,
talking about.
Leah, do me a favor. If you have the radio on in the background, please turn it down.
Okay, sorry.
Oh, no problem, no problem. This way we can hear what you want to hear your question, and Dr. Manick can hear you. Go ahead.
So earlier I was listening when the lady was talking about symptoms. She talked about prioritizing people who are like older in age or who already have like health issues. But there have been patients who've been tested who had no symptoms. Like, for example, there have been a few famous people who shared their experience about being tested, and they came back positive, but they had no idea they were infected. Excuse me. So, like, where does that leave everyone else? Like, some people are symptomatic and some people aren't. Like, I'm an essential worker, and I feel fine, but I'm interacting with so many people. So do I just wait till things get worse to get tested, or, like, where does that leave me?
So healthcare workers, you have different. If you're a healthcare worker, you are in a different category. So you don't fit in the same category as the general population because you are higher risk for exposure. So you could actually get tested whenever you want to get tested, right? A lot of celebrities, like Idris Elba, for example, when he got tested because someone he got in contact with, was diagnosed.
They informed him.
They informed him, correct.
That they were positive.
Correct, that he got tested at that point, right? And then, then his wife got tested because she was clearly next to him, right, in that sense. So healthcare workers, yes, you can get tested. You don't need to wait to get symptoms if you actually get a test as a healthcare worker, right? You're in the front line, so you could get tested.
All right, let's just go over the symptoms again for people because there's kind of now a package of symptoms or combo of symptoms, right, that you have to that distinguish this from the regular flu.
Correct. So you have a fever, very high fever. You feel tired. I've heard of people with a disease. A lot of patients would say they feel like all their joints hurt, kind of, right? So you get tiredness and like pain, like overall sense of pain. You have a dry cough. So it's a dry cough. It's not productive cough. So it's dry cough. And then recently, what we hear in some patients. So those 4 things I mentioned earlier, those are the most common things you'll find, right? Overall. And then the next piece of this is if you start losing your sense of taste or smell.
That's a new one.
That's the new one.
That
correct.
you bring into us.
They're correct. And so that's something that people are reporting a lot more now. I'm realizing that
and
people.
And that's very unusual. That's not like a fever or coughing or.
Correct. If you're having a Popeye's fried chicken and you can smell that chicken sandwich, then there's definitely something wrong, right? If you are tasting and you feel like you have a lack of appetite and you don't necessarily feel like it's a norm and you have fever and you're coughing, most likely you should get tested.
And if you have real shortness of breath, you need to take that seriously, like immediately.
No, correct. And hopefully you don't get that far, right? That's if you're feeling tired and fatigued and you have difficulty breathing, definitely you should do that.
Now the International Club King has turned into the International Quarantine King. We're going to talk
exactly.
We're going to talk about that in a second, but first I wanted to get you on the air because there's just so much serious information, and the situation is serious that we're all facing right now and dealing with, and I just it's so uplifting when you hear about how people are reaching out to help others, and when I saw that post that you had on your Instagram about your restaurant Blend Astoria helping the hospital workers and the people in the community there, I was like, that was so amazing, really amazing.
Yeah, we're located in Astoria, Queens, and actually one of our workers works at the hospital part-time, and shout out to Joanne, by the way, and she was like, it's so crazy over there. It's becoming unbearable. And then, we said, what can we do? And automatically, the first thing that popped up is let's send some food over, help out, and, help the staff out. So it started like that. And actually, it kept growing, Lisa, because now what we're doing is, I also have a pizza shop. And, everybody loves pizza.
Right.
So what we're doing now is we're donating pies. And the people can also help us by donating a pie. And then whatever pie they donate, we match the pie. So at the end of the day, for instance, yesterday we had somebody donate 19 pies. So today we're going to deliver 38 pies, and we're going out to 5 hospitals today.
In Queens?
Today in Queens. Today we're going
which is
to
the
Greenberg.
epicenter, which just for our listeners and our listeners around the country and around the world, that's Queens where Camilo is right now, and where his home base is basically the epicenter of New York City, which is the epicenter of the United States. So go ahead.
Correct.
So you got this matching pie program. How can people support that?
Well, two things. They can even go to sliceastoria.com. Then they could go to my page at DJ Camilo on Instagram. All the info's there. We're actually going to Elmhurst Hospital today, which is one of the most hospitals under stress right now because they're getting hit crazy. I grew up in Jackson Heights, Queens, which is right next to the Elmhurst. So I know the hospital very well. As a little kid, I was there getting checkups and all types of stuff. And, they're going through it really bad. So today we're going to hit five hospitals, Elmhurst Hospital being one of them, Jamaica Hospital being one of them, Columbia Presbyterian, Greenberg Pavilion, and NYU Winthrop, which is actually right there in the city, but it's close to Astoria, Queens. So we're trying to do our part, Lisa.
No, you do it. That is fantastic what you're doing, and it's and the one hospital that had so many deaths there, just 13 deaths in one day. There's the physical strain, Dr. Manny, on the workers, on the frontline healthcare workers too. But I think it's no matter how professional you are, you're still a human being. It's got to be like an emotional stress too.
Correct. So if you think about it on a typical day, right? Doctors and nurses and every other health worker, the janitors and everyone else that works in the hospital setting, for example, they have to show up. Now they are at capacity, right? So you have a lot more work with patients that are more sick. You're stressed. Everyone is stressed around it. There's nothing you could do to relax.
You got to worry about equipment. Are you going to have equipment?
Correct. You have to worry about it. Do you have equipment or not? So burnout, even before coronavirus, was pretty high in healthcare. And so being able, to have even pizza delivered, for example, right, showing that someone cares, just the basic idea of other people care. And we are here because we want you to live and want you to survive, so we're risking our lives. And that you do recognize that, and you bring in some nice, tasty pizza, and I'm sure it definitely puts smiles on faces.
Definitely.
Of course.
No, Camilo, that's so fantastic. So people need to go to sliceastoria.com or DJ Camilo's Instagram page, and you can do that matching pie program.
Correct. And, all of a sudden we have tons of people. How can I help? How can I help? Well, just, you want to donate a pie, we'll match it. And at the end of the day, we'll do the numbers. The next day, we're just going to go and ourselves and deliver these great pizza for everybody.
And the best thing is you could donate by being home. You could stay home and still donate.
Right.
Right?
And they can call, they can call over the phone or whatever and give a credit card or something.
They can call over the phone. The information's on my page at DJ Camilo on Instagram. It's actually two pizza shops. It's Slice Astoria and Slice LIC. So it's slicelic.com and sliceastoria.com. All the information there. And, everybody loves pizza. And this is the best way to put some smiles in our nurses and doctors who are stressed right now,
Oh, my God. And thank you to everybody. Thank you to the hospital workers and
maybe they
medical
could deliver
workers.
some to the studio as well.
Yeah, that's not a bad idea.
I don't want to take them from the... Listen,
just leave it outside.
This is rare for Camilo in his lifetime to be up this early on a Sunday morning. But you know what? I've been up since 4:00. We're working every day. We might as well. No, but we don't want to take away from the those that are on the real front lines, the healthcare workers. Camilo, in terms of but thank you for what you're doing and the example that you're setting. It's just another part of hip hop giving back too, and hip hop doing its part. We saw Rihanna give $5 million. To these organizations. Governor Cuomo shouted her out and everything. And let me just ask you real quick about the International Quarantine King, because we call you the International Club King because you travel around the world giving parties to these rammed out clubs. And then now you're in your living room. How are your neighbors dealing with that?
Well, my neighbors are cool. And actually, what I did, I went down to my basement, which I don't get to do a lot. But, what I did is I went on IG Live, and, we had a big party. And, we were on live DJing for 2 hours. I had a total of almost 30,000 people on my IG, and I just played for 2 hours straight. It was so much fun because I was interacting with people. But the crazy part is the next day my DMs were so crazy. Like everybody, oh, my God, I had so much fun. You got my mind out of all the stress I'm going through. We're stuck at home. We're stuck at home. We can't do nothing. We're partying with you. When are you going to do it again? When is the next live? When is the next party? And, to be honest, we all got inspired by DJ D Nice.
Yeah, who was on the show, who was on Street Soldiers yesterday, yeah.
who got on live last week, and he inspired all of us to get on the live and just, DJ and play great music for everybody at home.
Right. No, that's fantastic. When is the next DJ?
I'm thinking either today I'll do something called like the brunch.
Like Sunday brunch. Okay, there you go.
Sunday brunch, and maybe tomorrow, like only the cool kids party with Camilo on a Monday,
There you go. There you go. And keeping it moving and keeping us happy and keeping those hospital workers fed. DJ Camilo, thank you so much for being with us. We really appreciate it. Keep up all the great work.
Thank you, Lisa.
But these are the things that we're learning about ourselves, right?
Yes.
We before, if you told someone that DJs could throw a party on an Instagram Live or whatever, like on the platforms, you think it's crazy, right? You have
exactly.
to be out. But now it's the new norm.
And it's fantastic because all these people, they're like, oh, I can't go to clubs anymore. I'm not going to go to clubs anymore. They're like, they can watch in their home. They can have that whole experience. Let's take some calls, Dr. Manny, while we got you here. And let's go to Tina right now. Tina, hi, you're on Hot 97. Go right ahead.
Hello?
Hello, Tina, you're on the air. Go right ahead.
Hi, so my question is, I'm a nurse. I actually just worked last night, so I need to get some sleep soon. But we have positive COVID patients, confirmed positive, and we are being told that we don't need an N95 to care for them as long as we're not in direct contact with sputum or doing any aerosolizing treatment. So, of course, we're concerned for our health. It's a mother-baby unit, so they're relatively healthy, but we still feel we should have protection when they're confirmed positive.
All right, I'm gonna let Dr. Manny answer that. Go ahead.
First of all, I want to thank you,
for what you're doing.
For what you're doing, right?
Me too.
Yes, I get.
Thank you, I appreciate it.
I have my younger sister actually. She's going through the GNP program right now in Seattle, and she's a nurse, and she's in the forefront of this. And my mom is visiting her right now, and she reaches out to me every single time about this whole concept about nurses and are they protected enough, right? And very interestingly, in her job, one of her jobs that she has in Seattle, they will not let them put on actual face masks to come in. It's a plastic surgeon's office. They will not let them do this. And so they're literally exposing them to like this high risk kind of environment, right? And this goes into the point of, we do know that N95 masks are the best masks for coronavirus protection. But then they give you certain rules and things and say, well, because this patient is not this or is not airbound at this particular point or based on this right distance. So that's not fair, right? Because then you're worried every single time. How do you take care of a patient and then while you are scared of the person because of the mask?
Right.
Right. So what is the best equipment out there? We all know it is the N95 mask. That's what everyone is using, and that's what is the best. So I think that should be there, and I think nurses should speak up, and we are here to support you, and and get the word out to make sure you get the right equipment.
And the Nurses Association has been speaking out.
Correct.
Talking about, because also too, don't they spend more time with patients than the actual doctors do, because the doctors are going or making rounds and everything, right?
Yes, I was actually trained in medicine by my nurses, right? So I think nurses, at the forefront of this. No doctor will survive without your nurse, right? So nurses are definitely play the most important role in medicine, right? And so we need to take care of them. And not only because of individual nurses, but what if they get sick? What happens when they get sick? Then they're out of work. And so we have more people coming in, flooding the systems. And we don't have these trained healthcare workers that are sacrificing their nights, right? I mean, the people that slept well last night, and then you see we have a nurse like this that's just coming home now and trying to sleep, right? And trying to catch up. So we need to protect them.
No, we absolutely need to protect them. Let's go to Jay right now. Jay, hi, you're on Hot 97. Go right ahead. Hey, Jay, what's your question? Hi, you're on Hot 97. Go right ahead. Hey, Jay. Okay, I think he's listening on the phone. Anyway, Dr. Manny, real quick. So just to sum up, because we still have callers, people asking in terms of essential workers who are not hospital workers, because hospital workers, we know they need it, the masks. Do you think we will have enough? Number one, do you think we will have enough masks and respirators and personal protective equipment and respirators for this crisis?
Yes, I think we're late in making the orders. We're late in the game, but I think we are catching up. But the problem now is how much you pay for them, because there's a lot of price gouging taking place now, right, around this. Based on demand and supply, but I think the supply is necessarily out there. But another challenge is the fact that we have to import this from other countries. That we, as a country, we're not even equipped enough to actually have factories internally that could actually do this, right? And there are many people out of work today, right? So I think, in American history in general, we've known that we're resilient people, right?
And we rise to the occasion.
Right, to the occasion. And now our backs are against the wall, and this is the time that has spurred innovation, and I think is a very new chapter in our country's history.
And then in terms of people protecting themselves, our essential workers, our drivers, our grocery store clerks, our liquor store clerks, our transportation, our building security, all of the people, exterminators, everybody that has to do these basic functions in our society. You're saying now, yes, they should be wearing any type of mask is better than no mask at all. Is that right?
Yes, I'm saying is don't be scared and terrified because all of us have to do this for us to survive as a society, right? So thank you for doing your work.
Right.
But we need you to be safe because we need you to be there, right? We need your families to be safe as well. So while you're doing what you were supposed to do, and we thank you for that, please make sure you keep your hands clean and make sure you protect your nose and you don't take your hands and put on your face.
And then also the gloves. So you wear gloves.
Correct.
And then for the people like the home attendant, like the man that was home, that was working with the children
From home to home.
the autistic children with autism, going into homes, the night worker going into homes. You're saying touch as few surfaces as possible.
Yes.
Right.
Surfaces as possible. Correct. And don't worry. Even if you're not that person, and you go to the ATM and you go to you touch screens or people's phones, chargers. Just make sure you are safe. Make sure you put on Purell or something or any kind of hand sanitizer. And then it's a Purell. It doesn't matter which one it is, right? And so you put it in your hand. Wash your hands with soap, and we know that's very effective. And then just keep your hands away from your face. I know it's very hard. I keep trying to touch my nose right now, even right. In your face.
And then with takeout and delivery food, microwave kills everything. So if you're super paranoid, you can nuke your food when you get it home, and that'll kill anything. But the bigger danger you're saying is the packaging. Is don't drag that packaging around the house, or let the kids grab the bag and go up to or go wherever they're going to eat. Get rid of the packaging ASAP.
Correct. The boxes, because we know it lives on a virus, right? I mean, on the boxes. It doesn't mean
On
the box is
cardboard.
infected. Correct. So cardboard or packaging, envelopes, mail. So make sure you could just pull out the mail, but put on gloves around, or as soon as you open it up, make sure you clean your hands.
All right, Dr. Manny Fombu, I want to thank you very much for being with us for this episode of Street Soldiers. We really appreciate it.
No, thanks for having me.